Talk, a platform for natural and holistic medicine. In our educational session today, we are going to talk about how acupuncture helps with pain management. Presenting this topic, we have Mylin Tran, a licensed acupuncturist from San Jose, California. She is also a diplomat of acupuncture and a certified quantum healer. She has helped a lot of users to alleviate their pain. Welcome, Mylin, to our show.
Thank you, Amita. I'm so happy and honored to be here to share my information with all of you. And I love questions, so please feel free to type it in the chat. And Amita, if you have any questions during the presentation, I'd be happy to answer them too.
Sure, we'll do it in a question Q&A format to start with, what causes pain or what causes imbalance.
Okay. So first, we have this TCM principle, and the TCM stands for Traditional Chinese Medicine, okay? And Huangdi Neijing is a classic Chinese text on how to treat pain and how to treat people and their issues. And their main thought is, if you have blockage, you have pain. But if you don't have blockage, you don't have pain, right? Because when you have a blockage, you have loss of function, and then you create this cycle of pain. So the phrase is, 不通则通，通则不通. So there's blockage, there's pain. No blockage, no pain. Easy, right? Thank you. Next page, please.
Yes.
So how does blockage happen? When we get emotional, right, you can have a lot of anger, or you're really sad, a lot of worry, a lot of fear, especially around this time, or you have even excess joy or lack of joy. That indicates a blockage in your body. And it, with each of those emotions, it tells us which organ and channels are affected by your emotions. If you have trauma from repetitive injuries, working at the same computer for 8 hours a day, or you were in a car accident, that can cause blockage. Your lifestyle would impact how it's blocked. So let's say you're, a competitive runner, or you garden a lot, right? So those will change. The weather, if it's too hot, too cold, too dry, that can affect you. And other environmental factors like smog and 5G and do you live by the freeway, pesticides, things like that. Diet is a big part in what you, how your body responds to stress and all of these things that can cause blockage. And exercise, if you do too much, do you do too little, are you doing them improperly, that can cause blockage. And stress is the number one key issue that causes blockage. If you're stressed out, that means that you don't have usually free flow where you can handle the stresses that are coming your way. And that in itself creates more blockage. And so it just, you keep creating these cycles of blockages. Thank you. So what kind of signs and symptoms do you see if you have blockage in your body? Pain, right? That's a big key indicator. It could be dull, it could be sharp, it could be constant, or it comes and goes, and it could be anywhere in your body. You can have sleeplessness, any types of insomnia, fatigue, difficulty breathing, or like a chest oppression, addictions, eating disorders, cravings, depression, PMS, moodiness. If you have an increase in that during your menstrual cycle, that's a good indicator. Post-traumatic stress disorder, and a lot more than that. But all of these symptoms can be acute or they can be chronic, meaning long-term. Okay, thank you.
So what does acupuncture do? I think that's the next one.
Right. So when we insert a needle into these acupuncture points, it's a way for us to enter the energy channels, and it creates an electrical discharge in the body, and it tells your body to, let's create a balance here for better flow of energy, right? And it helps promote your body's self-regulating ability, which is the amazing part. Here is an infrared image of needling. If you look on the left-hand side, before needling, you see the red spots on the shins and even part of the feet. Well, after you've needled for 20 minutes, right? You leave the needles in and you come back and you take another picture. You notice the inflammation on the right-hand side, the redness in the shins is pretty much gone, right? Now, they might not have addressed the feet because maybe the patient didn't complain about feet pain, so they might not have addressed that. Okay, thank you. So there's lots of benefits to acupuncture, and obviously a lot of people go to acupuncture for reducing pain, reducing inflammation. When you increase the blood flow, you reduce all those things, and you can also increase the range of motion. If you have drug-induced nausea, that can decrease the side effects. A lot of patients will say it promotes relaxation, it helps them with their anxiety, especially if they're an anxious person, and it can reduce muscle spasm. Now, in this picture here, you'll see some electrical nodes attached, clipped to the needles. That's called electroacupuncture. And even with regular acupuncture, but this increases the effect. You increase your endorphin release, which is your feel-good hormone, and then the serotonin increase, which is the mood enhancer hormone, and that just helps stabilize everything. So it also helps with chronic pain. So you're making yourself feel good, you're stabilizing your mood, and you're helping your pain.
Yeah, who benefits, I guess, that's the question. I all of us benefit from acupuncture.
All of us, everyone. And you see in this picture, even this little baby, right? Babies will enjoy acupuncture, maybe not in the beginning, but some babies are just attached to it. But everyone, infants, children, adolescents, adults, elderly, even your pets. And there are people specifically out there that needle pets, cats, and dogs, horses, you know, so all kinds of everybody.
I think the next question is, we understand how acupuncture works. What can acupuncture help with?
Yeah, so acupuncture can help with obviously repetitive stress, Bell's palsy, which, you know, people like, really? Yes. Migraines, headaches, that's a big one for a lot of people. Lower back pain, and I see a lot of that in the clinic too. Knee pain, carpal tunnel, neck pain, sprains, asthma. And then lesser known things such as morning sickness, allergies, PMS. Even if you have like onset or feeling like you're coming down with a cold or a flu, we can assist with that. Depression, balancing your emotions, getting rid of negative emotions. Hypertension, you know, high blood pressure. Stroke, people who've had stroke, we can get them to a better place. PTSD, again, post-traumatic stress disorder. And infertility is a big one. A lot of women and all other health issues, whether it's irregular menstruation or just mood or whatever it is in terms of women's health, where it's a great adjunct for them. So acupuncture can help with open up these blockages so you can enjoy a new feeling of free flow in your body. And there, if you go to the WHO and the NIH, they have approved list of conditions for acupuncture. Okay.
So I think after we get an acupuncture, what should a patient expect after the treatment?
So most patients generally will say, I feel so relaxed now and I just want to go home and go to sleep. And some of them have to go back to work, but you know, so they have to plan accordingly for that. Sometimes you'll feel a mild soreness because we have released big muscle groups, and you'll have achiness or pain for a couple of days after treatment. And that can mean that you're detoxing, okay? And so that's why you're feeling that experience. Bruising, occasionally you will have bleeding. Maybe we hit a blood vessel or something. And usually I'll know and I'll let a patient know, you may have some bruising there. Typically during the needling process, they should have a dull aching sensation in that area. And that usually indicates the chi is moving there and it's helping do what it's needed to do during the process. And you'll feel like maybe things have opened up and you're happier, freer. Some people say that they're warm, okay, after the treatment. So usually they're happy and they're like, wow, that was awesome. So that's it.
So let's talk about some other modalities of traditional Chinese medicine in addition to acupuncture that complement acupuncture.
Sure. So people recognize acupuncture as the insertion of the needles, whereas acupressure, we're applying pressure to the same points that we may needle you at. But acupressure really can be done on anywhere in the body. Sorry, where we apply points, and the same as acupuncture points, and it helps to relax your muscles. It also releases stagnation. And typically I use that a lot on people who are afraid of needles. Yes, there are people who come to acupuncture and say, I don't want acupuncture. So I start them out with acupressure. And usually they can overcome their fear of needles with me. Some, you may experience some soreness with the acupressure and maybe some bruising because maybe we've applied a little bit too much pressure. And a lot of people prefer touch therapy. They want to be touched. You know, they want to have the sensation of care and loving feeling. So this is an example of common symptoms that we can use with acupressure. And you can try this. So the picture on the left is normally used for headaches and constipation. And it falls on the back of your hand right here, okay? So you can press it just like that person and you can try it. And just squeeze on both sides just a little bit. And that can help you relieve your headache in the front here. And you might feel a soreness as you're pressing along, okay? And that is a common thing. Now, another example is having pain in the shoulder or upper arm. Also on your forearm, like near your elbow here. If you go down, you use the 4 fingers here. You just go down this line and you just feel around your forearm over here. And you can just apply a little pressure. You'll find sore points, especially if you have neck tension or shoulder tension. You'll find some sore points there, okay?
So let's talk about cupping and Gua Sha.
Yes, cupping and Gua Sha. Next slide, please.
Yes. So
the benefits to cupping and Gua Sha, I'll go over that first and then you'll see images of them in the next few slides. It stimulates the immune system by bringing blood flow and qi to the area of treatment. It helps release toxins. It helps remove qi and blood stagnation. It helps release muscle tension for aches and pains. It can also decrease coughing. So let's say you are having a coughing fit, right? Your lung qi is stuck. And so we can cup you or scrape you for Gua Sha, and that will help you get rid of your cough. It's really good for colds, especially the early stages of colds, and it may reduce fevers, especially if you're starting with those body aches, like you coming down with the flu. Awesome for that. Next slide. So you've seen athletes and movie stars that have used cupping therapy. So Michael Phelps win the Olympics. You see these little purple spots on his shoulder, right? That's from cupping marks. And even Gwyneth Paltrow, she's a fan of cupping. Those are also cupping marks. And these are pictures of how someone may cup you. So they use a pump cup for them, and they basically suck the air out of the cup and it pulls your skin up to create these marks. Okay. Next slide, please. Thank you. So this is, when we bring flow to the area and remove stagnation, you can get these marks. Now, there's two types, stationary cup and running cups are the two techniques. And this is the traditional style of cupping where we have a glass cup with a fire, and the fire creates the vacuum. So we put the cotton ball in the cup, take it out, and we stick the cup on the person's back, and that creates the suction. Now, see this purple color, that's pretty extreme. And these are the different skin reactions you can have after cupping. So this is healthy blood circulation, but you still have stagnation there causing you some pain. The darker it is, the more stagnant you are, and the blacker it is, the more toxic, the more toxins you have in your body. Okay, next slide, please. Thank you. So Gua Sha, also known as scraping, it's a technique where we use a smooth edge tool with some kind of lubricant. So you can see the different types of tools that people have used. In the past, they used like a bone or an ivory, some smooth surface, even wooden. Now, when I grew up, I used a quarter, and those were not fun to use. Now I use a soup spoon, okay? And I like those because I can wash them and do sterile techniques with them, as well as it has a nice smooth surface. So what we do is go back 1 second, sorry.
Oh, sorry.
Yeah. So we use a light scraping back and forth over an area when we use some kind of medicated oil like a Gua Sha oil to help promote the removal of the stagnation. And it's great for pain that doesn't want to go away, or you've done acupuncture and it's not helpful as you would like. And it's great for flu-like body aches. Okay, next slide, please. So people also use it with facials, and that's very mild, it's light touch, and it's to help lift and rejuvenate their face, right? And make them look younger. And who doesn't want to look younger? Now, you can make, you can do more moderate, where, see, she has some stagnation here and not as much on the right side. Now, someone who's more severe, you see they have it all over and it's a bit darker. And this is over 3 days. So in the beginning, it might look like this. The next day, 24 hours later, it's a little lighter. And by day 3, this person has like no more bruising, okay? And that's how some people recover. Now, some people may take less time. Some people may take more time, depending on how deep the scraping was. Thank you. So herbal medicine is another modality that we use to complement acupuncture. So herbs increase the efficacy of acupuncture, and it's often used in conjunction with acupuncture. So where acupuncture works from the outside into the body, letting the body heal itself, now the herbs act like Caltrans on the highway of repair on the inside with your body, helping your organs and channels remove the stagnation and have normal function. And, people always ask, is it safe? And yes, it is safe and effective when used as prescribed. Most of our herbs, the herbs that I use, I buy from reputable companies that check the herbs for, pesticides, toxins, and all that stuff. So they only use high quality herbs that are not high in those amounts, and that whatever is acceptable to them. And then they make the herbal decoctions for us. And usually they are in pill form or capsule forms, and we can get raw herbs too. But diagnosis is key to a successful herbal treatment. Thank you. Next slide, please. Okay.
Twina.
Yeah, Twina.
Twina. How do you? Okay.
Twina. Yeah, Twina. Okay, let's go to the next slide. So they pronounce it Twina. If you see these pictures down here, these are 3 different types of styles within Twina to do Chinese therapeutic massage. And Twei means push, and Na means to grasp. And we use that to remove stagnation by increasing blood flow and releasing tension in a variety of techniques. When I employ these three techniques here, it helps me understand where the patient is stuck in their body, what needs to be addressed, and then more questioning can continue. Okay, next slide. And this is great for children because children are very receptive to Twina. And here are two pictures on the left. And if you just squeeze your fingers up along their back, so their spine is here on either side of their spine, you just pinch all the way up. That helps boost their immunity. And you can do that up to a few times a day, okay? Also on the sacrum, if you just push, starting in the center, and you push up and out, that also helps them boost their kidneys, boost their immunity, and help with digestion and bowel movements and all that stuff. Thank you.
So I think now we come to the case studies. If you could share a few of the case studies, that would be.
Okay, let's go to the next one. Okay, so case study number 1. This is a 60-year-old male presenting with the following issues. He was experiencing numbness in the tips of his left fingers for several weeks, complaining of plantar fasciitis in both feet, which is worse in the morning. He has a history of low back issues and a history of laminectomy surgery. So he had 2 sessions using acupuncture, acupressure, Twina, far infrared heat therapy, which is basically a heat lamp where you use light to infiltrate deep into the skin and helps this self-healing repair. Ergonomics, meaning I talked to him about his posture, not only at his desk, but in his car and his exercise. What's he doing that's contributing to all these? So I also gave him stretching exercises, and he got homework to do. So that means he was sent home with things that he needed to follow to help him through some of these situations. And the results, well, his back pain decreased to about 15%, where he didn't feel like he had any pain left. The numbness in his left fingers reduced by more than 50%, and his plantar fasciitis pain reduced by more than 60%, and he showed no signs of limping once he left the office. Now, let me just go back to that. So with this gentleman, he did a lot of stretching and foam rolling and things like that at home. So he didn't aggravate it. So by the time he saw me, we were able to tackle more of his root issues so that he could function at a better rate. Okay, thank you. Case study number 2. I have a 43-year-old female presenting with the following issues. She had decreased range of motion in the left shoulder and arm. The pain had been increasing for 4 months, and it was getting worse when she was rotating her arms backwards. She would have a lot of pain in here. She also had a lot of tightness in her lower legs and thighs, which caused her a lot of fatigue. So after 3 sessions, applying almost the same things, acupuncture, acupressure, Twina, far infrared heat therapy, we also did cupping for her. And I had her do a lot of foam rolling at home, plus stretching exercises and more homework. And the results from those 3 sessions, her range of motion was good. It was better than 95%, and she could move her arms with no pain, okay, especially when she went backwards. And the next step is to work on releasing the tightness in her legs, because that was not a major complaint for her, but it was still part of her complaint issues. Then COVID-19 hit, so we could not address any more of her issues. Yeah. Okay. So case study number 3, she's a more complicated case, 58-year-old female presenting with chronic migraines with aura And if she didn't get the migraines, she would at least have daily headaches on the right side. This had been going on for 20 plus years after she was in a couple of car accidents. And she did get routine chiropractic care and massage, but it would never alleviate all of her issues. She had a lot of tension in her neck and upper shoulders. She also experienced left hip pain and right scapula tightness. She also complained of hot flashes. So we did weekly sessions for 2 months. And then after 2 months, she was in a really good place where we could taper off to every other week, every 3 weeks. And now it's maintenance every 4 to 6 weeks. Okay. And we did a lot of acupuncture, a lot of acupressure, Twina. We did herbal therapy. We talked about her diet a lot and also stretching exercises for her. The results, well, her migraines only happen once in a while now, and it's usually minor headaches here and there, but no more daily headaches. And she's not on as many medications as she used to be. And when she does get them, they're mostly related to stress or her cervical spine is out of alignment, and then she needs more chiropractic adjustments. She still has a little tension in her neck and shoulders, but they come and go depending on if she's babysitting her grandchildren or if she's weightlifting too much, right? And her hot flashes are significantly better. So she doesn't experience them as much. And if she feels like they're getting out of hand again, she goes back on the herbs for a little bit and then she's back to normal. So that's it. Yeah.
So to summarize,
yeah, acupuncture works. And in this picture, it's I love this one. As you can see, he says, "That's odd. My neck suddenly feels better." Well, he's got all these little needles in his buttocks and legs, and his neck is good. And that is very very acupuncture. Yes.
That's great. We open it up for questions and answers.
Okay.
Let's see. I see someone. Okay. Oh no, that was just something.
Okay.
Any questions, please, from the audience who's listening to this presentation? Okay. Well, I think maybe how much time does it typically take, like for I guess
for a session?
Yeah, for a session, and also for severity of the pain. Like, from instance, I had frozen shoulders, so it'll take probably more depending on that. So maybe you could talk about how many sessions, the frequency of the sessions has to be.
Sure. So typically a session is about 1 hour long, okay, after the initial session. And it does depend on the severity of your issue and depending on what are you doing to continually aggravate the situation once you leave the office. Because you can feel great in the office and then you leave and you feel horrible. Or you'll feel good for a few days and then you go back to being bad, right? Feeling bad again. So typically I'll see patients weekly for 4 to 6 weeks. And then we do a reassessment. What's working for you? And we do an assessment every week that they come. What's working for you? What didn't work for you? What progress did you make? What progress you didn't make? And then I make adjustments based on that. So for frozen shoulders are extremely difficult because you're always using it. And there's so many moving parts in it. You have to find the right combination to get it to work again, right? So yes, frozen shoulder can take a bit longer.
Okay, I think we have a question. Let me stop the share and see. Okay. Does pain come back since people don't change? That's
well, you think about it. If you're not taking care of the root problem, yes, it can come back. But can it get you to a point where you understand what you're doing wrong that's contributing to it? That might help you maybe decide to change your ways. Right?
Okay. Yes.
Yeah.
Any other questions before we close?
Well,
Well,
Amita, did you have any other questions?
no, I think the frozen shoulder was one of the things that I wanted to ask, and also,
Okay.
how much time would it take for per session and the frequency of the session. But
Yeah.
answered
Yeah.
that depending on the pain levels and depending on what the user is going through.
Sure.
So I can vouch for my acupuncture sessions have been great and my pain has reduced. So I'm also one of the case studies that you
Yes.
mentioned.
Yes.
So definitely I vouch for that. If there are no other questions, someone is asking, can you do a remote session? I think this is a remote session. If there is any feedback
Yeah.
that you want to give us, please let us know. At care@nourishtalk.com, and let us know on Facebook. Let us know what kind of sessions we should bring for educational purpose. And before I close, would you like to say something as closing, Marvin?
Well, I would like to address the remote session because people are like, well, how do you do acupuncture remotely, right?
Yeah, I think that's what they mean. So I'm not sure how you can do acupuncture remotely.
Yeah, so
But
I'd like to address that. Can
okay.
you just put us back on video so people can see?
You are on video.
I am. Oh, I can. Oh,
Yes,
there I
yes,
am.
yes,
Okay,
yes, you are.
there we are. Okay.
Yeah.
I got some other view. So remote sessions on acupuncture. So I do a combination of we can talk about your diet, we can go through exercises. As a quantum healer, I do energy clearings, and sometimes the pain comes from not only a physical but a spiritual or energetic level. And so I didn't put that case study in here, but there was one woman who had pain for like months, and she tried, the massage and chiropractic, and it didn't work. So 2 sessions with me, and I said, if you tried these things and it didn't even help you and it's coming back, then there's on a different level. So when we did the energetic clearing, 2 sessions, she was back to normal. Okay. Now I also do energetic needling, and we can do phototherapy through that, through remote sessions too. And energetic needling is really working on the quantum field and imagining that I'm going to needle you in an area and you experience the same sensation as if you were in the office. Okay. Now that might be hard to believe for some folks, but it can happen, and it does happen. And so that's
Remotely.
remotely. Yes. Yes. And I've been doing that since the shelter in place. And now 50% of my practice is remotely.
And the herbs, I would think that the Chinese herb, if you could if you were
We
to
could send
diagnose,
them to the
right?
patients. Yeah. Yeah. So I could still look at your tongue on Zoom, and then we talk about other things. I've even heard of some woman using taking pulse. We'll take your pulse, and we can. I'm not sure she's doing it through an electrogram or something, and then from that they can all see how your pulse is acting, and then we can do questioning on that. So that's something new too. So we're getting inventive here, to make this work. I did see a question. How are herbs different from oils?
Yes.
So oils are more refined, and you can really control the potency of it. So it depends on how the oils are extracted from the herbs. And with that, someone who is very sensitive to herbs might do better with oils. And so you can use that. The oils come in liquid form, whereas the herbs can come in raw herb form, where you have to cook them in a pot, then you drink the liquid. Or it can come in pill form, or it can come in capsule form. And we can even use our herbs as plasters, external ointments, anything like that. Okay. So with the oils, you can also ingest them or you can use them as a topical.
You can ingest them through your nose or through your mouth. Is
Through
that
your
the
mouth,
difference?
yeah, you can add it into your food.
Yeah, of course.
Yeah, you can also with oils, you can diffuse them, right, in the diffuser.
Mhm.
And a lot of people are using that right now. Yeah,
Sure.
yeah.
Okay. Any more questions before we sign off? I just want to wait for a moment because unless I sign off and then the question comes.
Yeah, I know. Okay. Yeah, I'll
Okay.
do those. Okay.
Okay. All right. So please let us know your feedback. What kind of topics you'd like to see. Mylin is available for consultations. We can send all the details after the program. Oh, there's
Okay.
another question. See, when I told you when I'm ready to say sign up, then some question comes. Will acupuncture help with the thyroid function?
Ah, um, yes, acupuncture can help with thyroid function. Finding the root to the thyroid issue is can be more complicated for each individual, and so I use not only acupuncture but something called NAET, which is Nambutapad's allergy elimination technique, and I'll just type that into the chat for you. Um, and that is a way for us to use muscle testing to find out what the patient has issues with in terms of food, environment, thoughts, emotions, people, clothing. I mean, and they can exhibit an allergy to that. And that could be what is causing their thyroid function issues or any other problems like allergies and stuff like that. Yeah.
Okay. All
Yeah.
right. So, any other questions, please?
Amita, have you heard of NAET before?
No,
No. Okay. Yeah.
no, I don't know about NAET. No.
Okay. Yeah. So it's a way where we use allergy elimination to determine what it is that's causing you your headaches or causing you your chronic colds or what's causing you to cough all the time. Yeah. Like, some people have a clearing of their throat, and it turned out for me that I was allergic to ginger. And guess what? We eat ginger all the time.
But I just
So,
find acupuncture fascinating. That's
yeah.
it's just
Yeah. So, yeah, that's another technique. Anyway.
great, great.
Yeah.
All right. So I think finally we are going to sign off. Final words from Mylin before we sign off.
Well, I hope everyone here has learned a little bit more about acupuncture, and that if you are fearful of needles, there are other ways we can treat you in person or remotely. And, just keep an open mind, and you never know, and an open heart, and things will come your way. Thank you.
Thank you. Thank you for being with us. And thank you so much for watching us. My name is Amita. And please give us your feedback at care@nourishtalk.com. We will share the video with all the attendees. Like us on Facebook at Nourish Talk. And we want to thank all of you for attending our session today. Thank you so much.
Thank you. Bye-bye.
Bye-bye.